Adults with mental health or substance use disorders, also known as behavioral health conditions, use tobacco at a significantly higher rate than adults without these disorders. Approximately a quarter of adults in the United States have some form of a behavioral health condition, and these adults consume almost 40% of all cigarettes smoked by adults. This is attributed in part to individuals with behavioral health conditions who smoke having less access to tobacco cessation treatment than the general population and delayed screening and treatment for tobacco use in behavioral health treatment settings, as well as across the healthcare services spectrum. There are many myths and misconceptions about tobacco use and recovery among those living with a behavioral health condition. Some important facts to consider during the duration of this video include: individuals living with a behavioral health condition are interested in quitting at the same rate as the general population and can quit successfully at the same rate when provided evidence-based tobacco treatment options to support them. As many as 80% of clients in behavioral health settings are interested in treatment for tobacco use. Recovering from tobacco use can have significant positive impacts on other treatment efforts for individuals living with mental health or substance use disorders. These positive impacts include optimizing psychiatric medication effects, increasing satisfaction with care, improving health outcomes, and preventing death. According to a study conducted by the American Psychological Association, quitting tobacco during substance use treatment is linked to a 25% increase in long-term recovery. Smoking can worsen mental health symptoms and have adverse interactions with medications. The stress or anxiety that a person may experience during a quit attempt is actually nicotine withdrawal, which typically subsides within 2 to 4 weeks of abstaining from tobacco use. Trauma in childhood is associated with early initiation of tobacco use, adult tobacco use, and duration and intensity of use, meaning that prevention and early intervention are key in tobacco use recovery. Now let's talk about nicotine dependence. Nicotine dependence shows high comorbidity with many mental health disorders, including but not limited to attention deficit hyperactivity disorder, anxiety disorders, and depression. Nicotine dependence has proven to be especially challenging for individuals suffering from psychiatric disorders such as schizophrenia. Because nicotine has mood-altering effects that can temporarily mask the symptoms of mental health disorders, it puts those with these disorders at a higher risk for tobacco use and nicotine dependence. Tobacco use, specifically smoking, may serve as a stimulus to other substance use and reinforces substance misuse coping beliefs while also being a lethal and ineffective long-term coping strategy for managing stress. Overall, people with behavioral health conditions die about 5 years earlier than those without, and many of these deaths are attributed to diseases caused by tobacco use. Those with serious mental health disorders who use tobacco die almost 15 years earlier than individuals without these disorders who do not use tobacco products. Over the last decade, substantial progress has been achieved in the treatment of tobacco use and dependence among people living with behavioral health conditions. However, the rates of tobacco use and dependence remain high in this population. When people are under pressure from multiple forms of stress like financial strain, discrimination, or housing insecurity, they become much more likely to smoke. People with behavioral health conditions are significantly more likely to have stressful living conditions than the general population. This helps to explain why adults with behavioral health conditions are twice as likely to smoke than adults without these disorders. Additionally, the tobacco industry has long targeted people with behavioral health conditions. Just a couple decades ago, companies sent free or discounted cigarettes to psychiatric hospitals in an effort to hook patients. Today, their marketing strategies target low-income neighborhoods. As a result, people living with a serious mental illness are twice as likely as the general population to live in a neighborhood with a lot of tobacco retailers and high levels of advertisements. Mental health and substance use providers are uniquely positioned to address tobacco use with their clients. Providers can start by first acknowledging that treating tobacco use and dependence is one of the most important things you can do for your patient who is seeking behavioral health treatment. Individuals receiving care in the behavioral health setting deserve environments that recognize that addressing tobacco use treatment is safe, achievable, and enhances overall recovery. Address bias and misinformation that are barriers to tobacco-free settings and effective clinical services. Contribute to living a self-directed life and striving to reach their full potential. And finally, promote hope and guidance to improve their health and wellness. Now, let's dive further into how behavioral health care providers and facilities are uniquely positioned to address tobacco use and recovery in the treatment setting. Providers often have regular, close contact with clients, making it an ideal setting to deliver ongoing tobacco cessation treatment and support. Additionally, clients expect their healthcare professionals to encourage them to quit using tobacco. Individuals who have the help of a healthcare provider are more than 2 times more likely to quit than those without this support. Individuals with behavioral health conditions have far less access to tobacco cessation treatment options across all healthcare systems than tobacco users in the general population. The first step in addressing this disparity is taking the critical step of implementing a screening practice for tobacco use. Screening practices such as expanding the vital signs to include tobacco use status or using electronic health records that include prompts to allow clinicians to screen for tobacco use and nicotine dependence significantly increases rates of clinician intervention, allowing screening to be an important first step in the process to also improve access to tobacco cessation treatment. Training in evidence-based treatments and motivational interviewing is essential for providers and client-facing staff who may also play a role in screening and assessment, counseling treatment, referral, and follow-up supports. Partnering with your clients to provide tobacco use treatment promotes recovery and wellness while empowering the individual with resiliency skills on their journey to recovery. Once individuals with behavioral health conditions who use tobacco are identified through screening, offering tobacco cessation treatment is the natural next step. When tobacco cessation treatment is an option for the client, the treatment plan should address this addiction as it would any other. Recent studies have shown a strong link between tobacco cessation and substance use treatment success. Individuals with alcohol use and/or other substance use disorders who also stop using tobacco products are up to 8 times more likely to remain abstinent than those who do not. Effective tobacco cessation treatment practices tailor to the unique needs of each individual client. It is important to note that individuals living with behavioral health conditions often need more time to prepare to quit, enhanced medication treatment protocols, more intensive follow-up, and closer medication monitoring. Depending on office capacity, providers can choose whether to implement their own tobacco cessation counseling program or refer patients to the Tennessee Tobacco Quit Line, where they can receive free over-the-phone counseling and nicotine replacement therapy. In addition to screening and tobacco cessation treatment, behavioral health facilities have the opportunity to implement tobacco and vape-free campus policies to complement other evidence-based tobacco cessation interventions. In behavioral health treatment settings, tobacco-free campus policies are associated with increased attempts to quit, decreased frequency of use, and decreases in disruptive behaviors and aggression. Studies also show that implementing tobacco-free policies is easier than you would think, and overall benefits staff as well, including lower tobacco use rates in employees. Because tobacco cessation can increase long-term recovery from substance misuse, improve mental health, and provide many health benefits, the Substance Use and Mental Health Services Administration recommends the adoption of a tobacco-free facility policy and the integration of tobacco dependence treatment into behavioral health treatment settings. Right now, fewer than half of the nation's behavioral health facilities offer treatments that address tobacco use and nicotine dependence. A comprehensive effort is needed to reduce tobacco-related disparities among individuals living with behavioral health conditions. Screening, offering tobacco cessation treatment and support, and implementing a tobacco-free campus and grounds policy are the three main things you can do to improve the health of your patients and employees. It is up to all of us collectively as professionals in the healthcare and public health setting to ensure that everyone has access to the same resources, supports, and protections so that everyone has a fair chance to live a healthier life.